It is now my honor, excellent, to present an award to a fellow clinician who has done an exemplary job of helping his young patients thrive through Reach Out and Read. Each year, we present our Gerald Gilchrist Medical Champion Award to an outstanding clinician who has gone above and beyond to serve their young patients and make Reach Out and Read program all that it can be at their site. This award is named after Dr. Jerry Gilchrist, who was an early champion for the Reach Out and Read program in Minnesota and who practiced as a pediatric hematologist oncologist at the Mayo Clinic for 30 years. So it is especially fitting today that our award is going to another Mayo Clinic doctor this year. I am so pleased to share that this year's winner is Dr. Seth Gregory, a pediatrician at Mayo Clinic Health System in Red Wing. Dr. Gregory's leadership and enthusiasm have been instrumental in establishing the Reach Out and Read program at Mayo Red Wing Clinic. He has been a constant advocate for our program, both with his colleagues in the clinic and within his health system. In their glowing nomination, Dr. Gregory's clinic staff shared, quote, "He brings unmatched compassion, skill, and dedication to every patient and family he serves, and he has helped to foster a culture of literacy within the clinic." End quote. As you can see in the photo, Dr. Gregory is not only an advocate within the clinic, but also in his community. He volunteers with Reach Out and Read Minnesota annually at the Minnesota Children's Book Festival in Red Wing. According to Danette, our program specialist for Southern Minnesota, it quickly becomes evident how deeply connected he is to his patients and their families when they are at this festival. She says, quote, his young patients are consistently enthusiastic when they see him, reflecting the strong rapport he has built through his attentive and compassionate approach. Dr. Gregory's commitment to patient-centered care fosters an environment in which children feel valued and supported, and they respond with attentiveness and confidence in his guidance. End quote. Please help me in congratulating Dr. Seth Gregory on receiving his award.
Well, thank you for having me today. And I'm truly honored to receive the Gilchrist Award. I didn't come with any prepared remarks, so I'm going to go off the fly. And it's kind of hard to follow that. But I was first introduced to Reach Out and Read 13 years ago when I started my pediatric residency at Mayo Clinic. And my first impression with it was, as an intern, not really knowing what I was doing and walking into those patient rooms, having a book in my hand to read to the child was really, like, just really natural. I knew how to read. And walking into that room, it immediately just lowers the tension. Like, there's anxiety from the parent, there's anxiety from the child, anxiety for the doctor. And just being able to have a book and sit down and read to the child immediately helps, like, start that visit out on the right foot and really helps build trust. And that just compounds at the future visits where we hand out the books. And so when I finished my residency, I took my current job in Red Wing and at Mayo Clinic Health System. And we didn't have Reach Out and Read at that time. And I really did notice the difference. It was harder walking into those rooms, harder earning that trust, harder to get the 2-year-old to talk. Hear the parents promising you they know how to talk. But and over the years, we kind of realized, just through our community partnerships, there was a need to help improve childhood literacy in our community and kindergarten readiness. And so our clinic kind of thought about strategies on how we could help, and Reach Out and Read came to my mind as a perfect program for that. And so through partnering with Danette Cubitt, the Southern Minnesota program specialist, she helped us get that program out and running that first critical year where we didn't have any funding. And it was really well received by all my coworkers in our pediatric department. And everybody really just noticed that, yes, it, like, helped improve trust, no matter your view, like, between the patient, the provider. You could have different views on different things, but everybody could agree that reading to your child was important and building that bond with them is important. And they also came to realize how important it was for assessing like development. Reading to a kid is like you can really get good insight on their development during that visit. And so it was a big success. And then so we looked at our funding for future programs, and we had the Jones Foundation in Red Wing. And we applied for a grant, and we got grant funding for the subsequent years. And it's been great. We've kind of evolved our program a bit to empower our nursing staff. So like it's actually our nursing staff that go through the books and choose which books we hand out. So we get real buy-in into the program. So everybody has pride in it. Everybody is like on board with it. The providers are handing out the books, reading the books, and nursing has pride in that they help choose those books. And so it's been great. And yeah, going to the Minnesota Children's Book Fair, it's awesome seeing the kids come up and like talking about their books and saying, hey, and I really encourage you guys to come out and visit. It's a great event every year. But thank you so much for this award. It's actually the only award I've ever won. So I'm really honored. So, but no, thank you so much, and just thank you for what you do. Like you play a big impact in children's health and well-being, and I just appreciate seeing all you here. It's very encouraging. So thank you.